A warm welcome to everybody. I will be speaking upon provisional restorations. Now, provisional restorations means temporary. The word provisional means temporary, means for the time being. So these are the restorations we give to the patients till our final restoration has been fabricated. And that is why the term provisional restoration comes. So let's just look at the definition according to the glossary of prosthodontic terms, which defines a provisional restoration as a transitional restoration that provides protection, stabilization, function before the fabrication of a definitive prosthesis. It may also be used to determine the aesthetics, function and therapeutic effectiveness of the treatment plan. Now, the first part of the definition speaks about that it is for the time being, or it is what is called as temporary, till we get our final restoration. The second part of the definition speaks what are the functions of this provisional restoration. It means it has to serve the purpose of being aesthetic, it has to serve a function, and sometimes it also works as a therapeutic treatment. So let's look at all of them carefully a bit later. Now, before we fabricate something, it has to have its requirements, and ideal basic requirements, above which the restorations becomes successful. So let's look at what would be the requirements of these provisional restorations. The first and foremost would be the biologic requirements. It means biologically the restoration needs to protect whatever structures it is supposed to protect. That is first and foremost pulpal protection. Now don't forget that provisional restorations are given after the tooth preparation. So once we have done the tooth preparation, we have removed the enamel, we have exposed the dentine, and if the pulp is vital, the patient is going to be in pain once the local anesthesia subsides. So the first and foremost primary function of the provisional restoration when given in vital teeth would be to protect the underlying pulp. Right. The next function is the maintenance of the periodontal health. So the provisional restoration needs to be given so beautifully that it does not cause inflammation to the periodontal tissues, especially whenever our margins are going below the gingiva or they are going subgingival. So that's the second requirement of our provisional restoration. Occlusal compatibility. Our provisional restoration needs to be in occlusion to the opposing tooth. We cannot afford to have supra-eruption and migration of the teeth while the final restoration is getting fabricated. So it has to have its occlusal contacts in position. It also has to be stable and keep your dentition in stable. It should be easy to clean and not cause plaque accumulation. So this becomes our biologic requirements. Let's see what are its mechanical requirements. First and foremost, it needs to be resistance to functional load. It means it should have its required compressive strength. Whatever materials we are using should have a good mechanical property so that they are absolutely resistant to the occlusal forces which are coming. So they need to have good strength. They should be retentive. Even though they are temporary, it should not be that the provisional restoration is coming out every second day or third day. So it should be well retentive in its format. And it should maintain the intra-abutment alignment, which we have already spoken about. So when it has good contacts, it's going to maintain a very good alignment of the abutment teeth. Aesthetics. Now this becomes very important, especially when provisional restorations are being given in the anterior segment, and many a times this is what the patients are coming to us for. So if you have an anterior tooth that has been prepared, till the time your final restoration is coming, the provisional restoration has to serve the purpose of serving aesthetics. So it has to be as good, if not better than your final restoration. So it means the color or the shade has to be matched. It should be stable. The color should not, the material should not imbibe the coffee stains and tea stains while the provisional restoration is in its place. It should have a good contour. It should have whatever are the requirements in aesthetics, everything needs to be fulfilled with this provisional restoration. So those comes under aesthetics. It should be easily contourable if you are using a material for direct provisional restorations, which I'll explain in the future slides. So it should be translucent, color should be matching with the adjacent teeth, and color should be stable. It means the shade should not change during this period of provisional restorations. Fine, let's see the functional requirements are also the same thing. They should protect the underlying tissues, it should be stable, and it should serve the purpose of mastication as well. Means whatever crown I am giving as a provisional restoration, it should be functional for the patient till the final restoration is coming. Now let us see how we do this. There are two ways of doing it. Either you obtain something from the market, which is called as prefabricated, or you make it yourself, which is called as custom made. When I say prefabricated, again there are various forms which are available, like the anatomic metal forms, celluloid forms, polycarboxylate crowns. So they come in a given shape and size, and I select the shade and size depending on my requirement and then place it into the patient. That becomes prefabricated. Vis-a-vis custom made, where I actually make it according to the patient's dentition. So that is called as being custom made, which is majority of the time the kind of work we do. We generally avoid using prefabricated formats. We generally make it for the patient. We will see that also in greater details. What are the materials we can use for the fabrication of these crowns or these provisional restorations? Now mostly they are non-metallic because they are easier and faster to fabricate, but you also have a classification where you are using metallic formats of provisional restorations, like crowns can be used, or nickel chromium crowns can be used, or even the previous restoration of the patient can be used as a provisional restoration as a metal crown. Non-metallic formats are the most commonly used. You have bis GMA crowns, you have acrylic crowns, polycarboxylate crowns. Let's look at that in greater detail. So you have polymethyl methacrylates, polyethyl methacrylates, polyvinyl ethyl methacrylates, bis acrylic, that is bis GMA, UDMA, that is urethane dimethyl acrylates, and epimene resins. Now we have two ways of doing this. And this is a generic term. Whenever we say direct technique in prosthodontics, it means we are working directly into the patient's mouth. And whenever we say indirectly, it means we are working outside the patient's mouth. So there are two ways of making provisional restoration. Either I go direct into the patient's mouth and fabricate it, which comes under the category of direct technique, or I make an impression, pour a cast and fabricate it outside the patient's mouth and then cement it into the patient's mouth. That becomes an indirect technique. So generally, of course, and this is again generic in prosthodontics, anything which is done indirectly will always give me better results, because you have the cast in your hand, you can spend that kind of time, you can rotate it, look at it from the lingual side, look at it from the occlusal side, and you can take your own time to give incorporate details into it. So always the indirect techniques will give you better results than direct techniques. So now the indirect techniques in provisional restorations, though, are not always possible. Therefore we also have to understand how to directly fabricate a provisional restoration. But just let's look at the indirect techniques. Now the indirect techniques are going to give you more accuracy, like I just said. Now here what is other few small points are that avoid locking into the undercuts. That means make sure that your preparation is absolutely without undercuts, and it protects the pulp and it gives you better margins. We'll see how that happens slowly. When we are talking about the direct, the prefabricated versions or the materials that can be used for it, these are the various materials: cast metal crowns, aluminium, polycarboxylate, heat polymethyl methacrylates, autopolymerizing, and vacuum forms. Cast metals are not really used, more so for theoretical terms where you have prefabricated metals already available. Similarly, prefabricated metals in aluminium could be available, which could be bought, but we generally don't use them. Cellulose acetate crowns may be used. These are, as you can see in the diagram here, this is the diagram for this. Sometimes you get these prefabricated shells and you fill in a monomer polymer tooth colored material and peel off or cut off this structure once the material sets, and you can use them. Alternatively, Finally, I'll just finish with polycarboxylate crowns, which are also available. They are tooth-colored acrylic resins with different sizes, which can be used. So with this, we complete our prefabricated versions of provisional materials that are crowns that are available. We'll continue with this into the next lecture. Thank you.